Notice, the images of individuals appearing in this video serve solely for illustrative purposes. They may not represent actual doctors or patients. Thank you. Somatic Symptom Disorder, SSD, is a complex and often misunderstood mental health condition characterized by an excessive focus on physical symptoms, such as pain or fatigue, that causes significant emotional distress and difficulty in daily functioning. This disorder represents a key challenge in both psychological and medical fields, as it blurs the lines between mind and body, illustrating how psychological factors can manifest as physical symptoms. Individuals with SSD typically experience intense and persistent worries about their health. They may have one or more chronic physical symptoms for which no adequate medical explanation can be found, or if a medical condition is present, their reaction to it is excessively disproportionate. Unlike malingering, where a person feigns illness for external benefits, or hypochondriasis, now known as illness anxiety disorder, where the concern is about having a serious illness, SSD focuses more on the distress and disruption caused by the symptoms themselves. Regardless of whether a physical cause is identified, SSD often begins in early adulthood and can be triggered by stress or a traumatic event, though the exact causes are not fully understood. It's thought to be a complex interplay of genetic, biological, and environmental factors. People with a history of significant medical conditions during childhood, a family history of illness, or past trauma are at higher risk of developing SSD. The diagnostic criteria for SSD, according to the DSM-5 Diagnostic and Statistical Manual of Mental Disorders 5th edition, include having one or more distressing physical symptoms, excessive thoughts, feelings, or behaviors related to the symptoms, and significant distress or disruption to daily life for more than 6 months. These criteria highlight the importance of the psychological component in the experience and management of the symptoms. Treating SSD can be challenging because patients often seek multiple medical opinions and interventions, focusing on physical explanations and solutions for their distress. However, the most effective treatments are usually psychological. Cognitive behavioral therapy, CBT, is commonly used to help patients identify and change negative thought patterns and behaviors related to their symptoms. CBT can also help in managing the stress and emotional turmoil that accompany SSD. In some cases, antidepressants or other psychiatric medications may be prescribed, especially if there are co-occurring mental health disorders like anxiety or depression. It's crucial for healthcare providers to approach SSD with a combination of empathy and firmness. Establishing a consistent and supportive therapeutic relationship can help in managing the disorder. Regular follow-up appointments rather than multiple diagnostic tests or referrals can reassure the patient and help in building trust. Living with SSD is often an isolating experience, fraught with frustration and misunderstanding. The physical symptoms are real and distressing to the individual, even if they are not fully explained by a medical condition. It is important for friends, family, and medical providers to acknowledge the suffering of those with SSD and support them in seeking appropriate psychological treatment. Awareness and understanding of SSD are key to reducing the stigma associated with this condition and to providing effective care and support to those affected.